on this Sunday night. Should Quebec delay reopening? Concerns over the test the province is relying on to get back in business.
It didn't perform well.
And Canada's plans to increase the supply of PPE. A disturbing trend between COVID-19 and the ethnic population in the U.S. The mission to boost morale. Canada's snowbirds embark on an inspirational cross-country tour. And the love affair that didn't reveal itself for 60 years.
In the 1940s, it was dangerous.
Now the subject of a Canadian documentary.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin tonight with a setback for testing of COVID-19 across this country. An Ottawa biotech company is voluntarily recalling a rapid test for the virus after Health Canada raised concerns about its effectiveness. The Spartan test was called a game changer, and provinces were depending on it as they lay out plans to reopen for business. Michael Couteur has our top story tonight.
Instant diagnosis in the palm of your hand.
It was touted as a quick test for COVID-19 without having to send samples to a lab. But Ottawa-based Spartan Bioscience is recalling its handheld DNA analyzer after Health Canada expressed concerns about the company's proprietary swabs.
While the Spartan system, or the device, performed very well in a laboratory setting and along the specifications that the manufacturer had provided, it was in the real life setting, in the clinical setting, where it didn't perform well.
Dr. Tam doesn't believe this will affect the national testing goal of 60,000 Canadians a day, but it could affect the speed of testing in rural or remote areas. Spartan Bioscience declined our request for an interview, but said in a statement, the same report indicated no concerns regarding the accuracy and analytical performance of Spartan's test reagents and portable DNA analyzer device, adding they will work as quickly as possible to address the concerns and bring its test to market. And there's pressure to act fast. Ontario, Alberta, and Quebec had earmarked millions of dollars to buy the Spartan test kits, while at the same time promising to ramp up testing as they reopen their economies. So with testing still limited, the federal government is putting a focus on personal protective equipment with the creation of a new COVID-19 supply council.
As the economy starts to open in different places in different ways, it is going to be important to have even more personal protective equipment for people working in the private sector in various industries.
The council's job will be to find solutions to build innovative and agile supply chains to maintain Canada's stockpile of medical equipment like ventilators, masks, and other PPE.
This is procurement like it's never been done before for that very reason. We need to be planning for the short and the long term and all eventualities,
including a possible second surge of COVID-19 as provinces start to reopen for business. Michael Couture, Global News, Ottawa.
So far in Canada, nearly 1 million Canadians have been tested for COVID-19. Over 59,000 cases have come back positive for the virus since the outbreak began. More than 3,600 people have died. There is more financial help for Canadian families, an increase to the Canada Child Benefit. Anyone receiving a CCB check this month will see an extra $300 per child. Eligible families will see this one-time increase as part of the scheduled May payment. The federal government says this is part of a $2 billion relief fund to help families with the cost of taking care of their kids during this crisis. Britain's Prime Minister is revealing more about his dramatic close call with COVID-19. Boris Johnson says contingency plans were put in place in case he died. At one point, it was 50-50 whether or not doctors would put him on a ventilator. Johnson didn't have to go that route, but was given liters and liters of oxygen while undergoing treatment in intensive care. He also admitted he didn't take the disease seriously enough and was forced to go to hospital on the advice of doctors. In the U.S., there's concern tonight as 34 states relax restrictions and many Americans get ready to head back to work. Over 1 million people have been infected with COVID-19 in the U.S. More than 67,000 people have died. That's more than any other country. As the numbers spike across the U.S., the Trump administration claims there is evidence COVID-19 originated in a lab in China. As Jennifer Johnson reports, it's fueling tension about how the outbreak has been handled.
The Trump administration is again pointing the finger at China. U.S. Secretary of State Mike Pompeo claims there is evidence the COVID-19 virus came from a Wuhan lab, but isn't providing any proof for his claims.
President Trump is very clear. We're going to hold those responsible accountable, and we'll do so on a timeline that is our own.
Prime Minister Justin Trudeau is not ready to say exactly how this started.
We continue to work very closely with our partners and allies, and indeed independently, on many security issues that are important for Canadians. At this point, we are not drawing any firm conclusions.
American intelligence agencies are continuing to investigate whether a lab in China was the origin for this deadly pandemic. Meanwhile, from crowded beaches to reopened malls to protests across the U.S., more and more Americans are shoulder to shoulder, no protective masks, abandoning social distancing rules.
It's in God's hands what happens to me and my health.
White House coronavirus task force members are sounding the alarm.
It's devastatingly worrisome to me personally, because if they go home and infect their grandmother or their grandfather, they will feel guilty for the rest of our lives.
But some governors say they can't stop residents from not playing by the rules. In Ohio, a complete about-face. The governor first ordered shoppers to wear masks, then reversed his rule.
People were not going to accept the government telling them what to do. And so we put out, dozens and dozens of orders. That was one that it just went too far.
In Georgia, one of the first states to reopen, residents showing little concern at crowded indoor malls and outdoor parks, even as its COVID-19 death rate continues to increase.
It's a little shocking to see so many people just disregarding human life, not wearing protective masks, not staying 6 feet apart. Staying home and being social distanced has saved lives.
If this pattern continues, doctors and nurses on the front lines fear another surge in cases. Jennifer Johnson, Global News, Washington.
We've been told that everyone is susceptible to COVID-19, but in the U.S., doctors are seeing a stark divide in who's getting sick. Ethnic communities are especially vulnerable in this outbreak. As Jackson Proskow reports, experts believe historic inequities are to blame.
Across the U.S., doctors and nurses have noticed a disturbing trend when it comes to who's ending up in emergency rooms. People of color are being hit disproportionately hard by COVID-19.
I'm surprised about the magnitude of the impact. It's really, really obviously more impactful to people of color, particularly African Americans.
In Chicago, African Americans account for 67% of coronavirus deaths, despite making up just 32% of the city's population. It's the same story in Louisiana, where Gary Harrell has lost 10 family members and friends.
You can't ignore it. It just seems like so much.
What I see is COVID-19 exposing in a very stark fashion U.S. racism.
Dr. Kamara Jones is an epidemiologist at Harvard and says decades of inequality are taking their toll on communities that have less access to health care in populations with more underlying health conditions. There's another factor, too.
They don't have the kinds of jobs, on the whole, where they can just shelter in place and work from home. They're doing the front-facing home health care aid, bus driving, sanitation work, maintenance work in the hospitals.
84% of Latinos in the U.S. work in essential jobs. In some states, Latinos are contracting coronavirus at a rate 3 times higher than average. Jose Gonzalez says there's pressure to take any work.
We don't have the benefit of I should just stay home to, not carry on such a high risk. And I feel like that's every Latino at this point.
Cities across the U.S. have now begun to consider race as part of coronavirus statistics, using that to better target resources.
Wash your hands, wear gloves, and use a mask.
In Baltimore, that's led to a push to get information out.
The messaging, the public health guidance just simply was not penetrating certain segments of our community.
Communities that have been hit exceptionally hard by a virus that has taken an enormous toll. Jackson Proskow, Global News, Washington.
Communication is key to getting vital information out during this pandemic. That's why we are seeing daily updates from Canada's political and health leaders. But there are other key players in those briefings, the interpreters for the deaf, and that's one of the stories on our special series, The New Reality, which airs tonight. Our Mike Drolet is here with a sneak preview of the critical role they play. Mike?
Robin, they say information is king, and that's never been more true. We're getting daily COVID-19 updates in both official languages, but if you're deaf, it's hit or miss. Now, you may have seen stories in the news over the past month on interpreters. There have been a lot. Nigel Howard in BC has a fan page, and a guy in the US has developed a following because he looks like David Letterman. He's the same guy, by the way, who signed a Beyonce concert last year. But on this story, the media has missed the mark, because while interpreters are animated, they're really just speaking their language. So the real issues, like accessibility, that have plagued the deaf community for years, are being overlooked in favor of entertainment. So tonight on The New Reality, we take a deeper dive into American Sign Language and how a quiet world just got a whole lot quieter for the deaf community. Robin?
All right, thanks for that, Mike. And you can watch Mike's story tonight at 7 p.m. on our special series, Coronavirus, The New Reality, hosted by Donna Friesen. Coming up on Global National, those living in Alberta's flood zone may not be able to rely on insurance. There's tension tonight after North Korea and South Korea exchanged gunfire for the first time since 2017. According to South Korea, North Korea fired first. The bullets crossed the demilitarized zone, hitting a guard post in a central border town. South Korea shot back and issued a warning via loudspeaker. There was no further gunfire. U.S. intelligence suggests the North's attack was likely a mistake. According to a South Korean official, Kim Jong-un did not undergo surgery or any other medical procedure. There's been a lot of speculation about the dictator's health, including rumors of a heart operation. But here he was yesterday, smiling during a Labor Day celebration. Some observers noted his walk looked a bit stiff. The Prime Minister says more gun restrictions are on the way amid criticism his government didn't go far enough with its ban on 1,500 types of military-style assault weapons. That includes steps that could lead to prohibitions on handguns.
We know that there is more to do on strengthening gun control in this country, which is why we're going to be moving forward when Parliament allows it with stronger measures around borders, stronger measures around safe storage, measures around handguns to permit municipalities to ban handguns within their city limits.
But Conservative leaders like Alberta's Jason Kenney accused Trudeau of targeting law-abiding gun owners.
They should take that effort and those resources and focus on stopping the widespread smuggling of illegal firearms across the Canada-U.S. border. And so we're very disappointed that they're in the middle of this pandemic, I think, focused on the politics of this and going about it in the wrong way.
Trudeau made an election promise to ban military-style assault weapons. He moved ahead with it in the wake of that mass killing that claimed the lives of 22 people in Nova Scotia 2 weeks ago. In Fort McMurray, the floodwaters have receded and the damage is being uncovered. As Global's Breanna Karstens-Smith reports, in a neighborhood devastated by wildfires 4 years ago, insurance may not cover the costs of recovery a second time around.
This is the Waterways neighborhood in Lower Fort McMurray. 4 years ago today, 90% of the homes here were destroyed by fire when the wildfire came into the city, forcing everyone out. Now fast forward to this week, and it's water that's taken over and damaged pretty much every home in this neighborhood once again. A lot of these residents losing their home twice in just 4 years. Those we're speaking with are saying that the flooding is worse than the fire. Their insurance covered the fire damage, and it does not look like it will be covered for the water damage. They are now forced to try and save anything they can and figure out how to rebuild. We've also been seeing some cleanup in downtown Fort McMurray. That's where some of the big box stores are that will be needed to help clean up and rebuild. We're seeing the Walmart, the Canadian Tire, Rona, all closed and now doing their own cleanup. We spoke with Mayor Don Scott, who says that he will be asking both the provincial and federal governments for financial assistance to help the residents recover from this. We've also been speaking with Fire Chief Jody Butts. He says they really had to shift gears to go from fire to flood. They had to rescue more than 200 people this week who were not obeying mandatory evacuation orders. So a big change for him, but he says starting Monday, they are back to fire response because the wildfire season has started here in this region. And despite all the water, it does look that the risk will be quite high again this year. Reporting from Fort McMurray, Breanna Karstens-Smith, Global News.
Still ahead, secret no more. A love hidden for decades is now in the spotlight.
You're watching Global National.
Coming out as LGBTQ2 is still not an easy decision. In the case of a Saskatchewan couple, their love was hidden for decades. Now, Terry Donahue and Pat Henschel's life together is the subject of a documentary produced by a family member. Eric Sorensen has their story.
It's a love affair so unusual it was hidden behind a facade for more than 60 years. Terry Donahue and Pat Henschel were Saskatchewan farm girls when they met.
Until I met Pat, I don't know what happened, but that was it.
They fell in love, moved to the U.S., and told the world they were cousins.
Anybody who was not gay, they simply didn't know.
A new documentary chronicles their story from a friend first warning Terry about women in relationships.
And she said, I just want to let you know what goes on so you're aware of it.
To when Terry and Pat finally had the courage to tell their families.
How long have you guys been together?
65 and a half.
65 and a half years.
And they've always been anti-Terry and anti-Pat. Didn't know they were gay till 3 years ago.
What's so acceptable today was fraught with risk in the 1940s. Living as they did and the parties they went to could have landed them in jail. Terry Donahue's great-nephew made the film.
So I think it's a very special kind of love. And, you know, coming from the times they came from, in the 1940s, it was dangerous. Very dangerous. So the fact that they stayed true to who they were and listened to their hearts, I think, is an incredible story.
A story made more incredible because Terry was a baseball star. In an era when women's pro ball sprang up in minor league towns across the American Midwest because most men had gone to war, Terry played for the Peoria Red Wings, made to wear skirts, a code of conduct that brought even more deception, always appear in feminine attire, no slacks or shorts in public, longer hair preferred, lipstick always on, and the skirts, well, not too short. Hollywood told the baseball story with a light touch.
There's no crying in baseball!
But it reflected the reality for women ball players, always chaperoned, even made to go to charm school.
And sip down.
Terry said she liked breaking the rules.
They were playing baseball. Women didn't do that.
Terry and Pat were trailblazers, two women in love, living and working in Chicago for decades. They married just 5 years ago.
I wanted to show the younger generation today that the shoulders that they're standing on came from these pioneers, these groundbreakers.
With health issues, the couple moved back to Canada. Pat found some old love notes she'd written to Terry.
It was one night I shall remember, one more night, to call our own.
Ooh. Hey, that is beautiful. Ooh. Beautiful.
Terry Donahue died last year. Pat and Terry's love affair lasted more than 70 years. Fortunately, it was only a secret for 60. Eric Sorensen, Global News, Toronto.
Up next, the sky-high effort to boost Canadian morale in times of tragedy. The devastation felt from the mass killing in Nova Scotia was already compounded by the COVID-19 crisis. But then another tragedy occurred, the loss of 6 members of the Canadian Forces who died in a helicopter crash off the coast of Greece. To say Canadians are in need of a morale boost right now is an understatement, but there's a mission underway to lift spirits across the country. The snowbirds took off this morning for Operation Inspiration, flying over Nova Scotia and New Brunswick. They'll make their way right across the country to honor all Canadians doing their part in the COVID-19 pandemic. But as Mike Armstrong explains, Operation Inspiration kicks off on an important day in Canada's military history.
Now, this is what should have been on a normal first Sunday in May. Hundreds on hand at the National War Memorial in Ottawa to commemorate the end of the Battle of the Atlantic. Instead, it was this, a video shared by the Royal Canadian Navy on Facebook, just 2 members and a single wreath. The Battle of the Atlantic cost the lives of 1,600 merchant seamen, 750 airmen, and close to 2,000 Canadian sailors. It was Canada's longest military engagement, 6 years spent fighting German U-boats, keeping Allied supply lines to Europe open.
Today marks the 75th anniversary of the Battle of the Atlantic. As we remember the sailors, soldiers, and pilots who helped turn the tide of the Second World War, we honor all our veterans who stepped forward so we may live in peace.
The Royal Canadian Navy moved the commemorations of this anniversary online. Ships shared videos Sunday of their services. This was HMCS Winnipeg. This was HMCS Moncton. The commemoration was not the one they're used to. Now, at every ceremony this year, there are heavy hearts. At the National War Memorial, by that lone wreath, a reminder that the sacrifice of those in uniform continues. Photographs of the 6 members of the Canadian Armed Forces killed this week in a helicopter crash off the coast of Greece.
These 6 members paid that ultimate sacrifice.
The 6 were remembered in a memorial at the gates of Nova Scotia's CFB Shearwater. It's the downed helicopter's home base. The event was organized by a veterans group. One of the fallen sailors was a member, Sub-Lieutenant Abigail Cobra.
She was a ray of sunshine. She was a beautiful, beautiful person, and so young, 23.
Now, the Shearwater Gates was one of the first flyovers for the Snowbirds Sunday as they kicked off their cross-Canada tour. Mike Armstrong, Global News, Montreal.
And that is Global National for this Sunday. I'm Robin Gill. We leave you tonight with more of today's stunning flybys. Thank you for watching. Good night.